I want to mention are primitive reflexes. This is so overlooked and so misunderstood, it's incredible. Primitive reflexes are reflexes inherent to the body, to the person, before birth and then just after birth, up to about 9 months max after birth. We see these primitive reflexes. And you know some of these. The moral reflex, for example, is a lot of times called the startle reflex, right? If you take a newborn infant and you hold them in your hands and you kind of startle them, right? If you clap real loud or if you kind of, not drop, but you kind of, whoosh, do the little kind of, wee kind of thing with them, they startle. And what happens when they're startled? Well, it's reflexive. Their arms fly out, their legs fly open, their eyes open wide. Usually they'll start crying, right? That's a standard reflex inherent to all babies. And usually it goes away after about 4 months. Sometimes, however, we see these reflexes maintain themselves beyond the postnatal landmark that we're supposed to see them go away at. Sometimes we see them perpetuate. Now, you can't take a grown adult and hold them in your arms and pretend to drop them. That doesn't usually work. But there's other ways of testing it, right? I can take a grown adult, and we've done this before, and hold their head in my hand, and then really quickly drop the head. Not drop, but really quickly move it downward so it feels like they're dropping, and observe what happens. And if I see an arm fly out, maybe not both, probably not both. If I see other signs of that moral reflex, I know that reflex has maintained itself. How does it do that? Well, these reflexes are remitted. They're done away with. They're removed by having milestones, movement milestones. So you think about this. A baby's born, what can they do? Well, not much. They can wiggle their torso around a little bit. That wriggling of the torso helps to take care of and get rid of that moral reflex, the startle reflex. Well, then what do? Well, they can lay on their back and they start to move their head and lift their head and roll over. That helps with the tonic labyrinthine and the asymmetrical tonic neck reflex. And then what else? Well, they turn over on their belly and they lift their heads up and they start to crawl and creep, and that helps get rid of the spinal galant reflex. And so on and so forth. Movement of the infant in predictable stages gets rid of these reflexes. And so we can use these reflexes to our advantage to understand the state of the brain neurologically. Is the brain halted? Was the brain halted in its development? My son, for example, Ethan, now, I was so proud of him because he only crawled for like a week and then jumped up to walking right away. And I thought, well, I must be an amazing parent because my son almost skipped the crawling stage. He went straight from sitting up to walking. I'm an amazing parent and I have an amazing child. Well, you know what? Maybe I am, maybe I'm not. But he missed a stage, a critical stage. And so understanding these primitive reflexes now, he has a spinal galant reflex that's still there. Spinal galant is checked. You lay the person down on their stomach or have them on all fours. And then you take not a sharp, but a kind of sharp, a pointed object. I use my fingernail. You can use something else. And you drag it along the lower part of one side of their spine. And if the patient pulls to that side, they arc their back to that side, making kind of a C with their spine, that's a positive result for a spinal galant reflex. And we know that reflex is there. Usually it will be unilateral, meaning you'll see it on one side and not so much on the other side. And so you'll see that spinal galant reflex on one side or the other. And that's what I saw for my son. And that is there because he skipped that stage. He skipped that stage because of a neurologic compromise. I have my ideas of what caused that compromise, but that was there. Before I was able to make any sort of progress with my son's anxiety, we had to get rid of that spinal galant reflex. And there's simple exercises that you can do to get rid of that. Simple exercises that can be done every day at home, and they go away really quickly. But if we don't address the primitive reflexes, any sort of neurological intervention that we take is not going to be as effective as we want it to be. Period. Including medications. including cognitive behavioral therapy. We'll talk about that later on. Talk therapy, counseling. If those reflexes are there, if those primitive reflexes have not gone away, then our efforts are going to be non-effective, not as effective as they should be. And so for anxiety patients, a lot of times we see a perpetuation of the Moro reflex. Spinal galant reflex, asymmetrical tonic neck reflex, and sometimes the tonic labyrinthine reflex. And you can look at those common symptoms associated with the perpetuation of those reflexes there. Some of you will say, well, yeah, that sounds familiar. That one sounds real familiar. Yes, yes, yes. But I found that in nearly all of my anxiety patients, there's something there. There's a primitive reflex that's maintained itself, that has not gone away, and that needs to be dealt with. And again, simple exercises. That's all we need to do. But specific exercises to each one of these reflexes. So those need to be assessed. Okay.